Hello, I'm Dr. David Hornbrook, and I'm back with another episode of A View from the Other Side of the Bench. As you know, I'm a clinician and the Director of Education at Utah Valley Dental Lab. So when I look at things, I think, what do I need? What do I need to be doing differently to offer my patients better care? And then as a Director of Education at Utah Valley Dental Lab, I think, what should the doctor be doing for me, or what can I do to provide a better restoration for that particular patient? So today I'm with JD Henderson. Hey, JD.
Nice
JD is the manager of Utah Valley Dental Lab. Nice to meet you. We've only met each other for the last 20 years, but that's okay. I want to talk about articulators because a very common question in my lectures, and I know when you talk to doctors every day, is what articulator should I use? Or I have one, do I have to send it to you, or can you cross mount? There's a lot of questions. So, we just grabbed some of the ones, and this represents, I think, the majority of the articulators that we use at UVDL. But let's talk a little bit about maybe some of the advantages, disadvantages of these systems, JD. And also, another question that comes up all the time with you, especially with the young doctors that we're involved with, is, I have my old articulator from dental school and I want to buy a new one that I can work with my lab, that I won't grow out of. What should I be looking for? And I'm going to give you a quick background on JD. He does all the model work and all the lab communication for Dr. Mark Montgomery and my occlusion course. He's done that for the last 15 years. He went through the COIS programs, went through OBI, which is a very intense occlusion-related program. And so he's got this great eclectic background that I always learn from him as well. So let's start from right to left, or wherever you want to start.
Yeah, let's start with the Danar first. So this is probably one of the most recognizable articulators out there, these old Danars. This one happens to be held together with springs, but a lot of lab technicians don't like these because they tend to fall apart. The old whip mixes did the same thing. A lot of the whip mixes are the ones that are popular in dental school now. Not our preferences. We have a number of different issues with them. These, we actually have a calibration tool. I should have brought it out here because it's really cool looking, but it's so complicated to calibrate one of these. There's only a handful of us that I even know in the country probably even know how to use those calibration tools for these. So these are tough to keep in calibration. We don't really like them. And Danar's come out with this articulator. This is their new version. If you're going to do something, start to get rid of some of these. These are 20, 30 years old. This is more state of the art. But even then, get these that have magnets on them. The magnetic part of these makes this so much easier for the technician. You're not banging the models around as much. And being able to have that versatility for a technician when he has to switch in between different cases on their bench, really a time saver for them if you have a magnet system on them. And the magnet systems cost a little bit more, but it's more than worth it.
Yeah. Let me interrupt you here. The calibration jig, one of my goals, and I use a couple of these articulators. I use the Stratus as well as the PandaNet, is I don't really want to send my articulator. If you remember dental school or in the past, you've got a big case and you're shipping your articulator with your case. I don't want to do that. I want an articulator in my office, and I want it to correspond to the same articulator system at the lab. So talk a little bit about the calibration, because literally I could send my Stratus to you.
Yes.
And you could calibrate it to one here on the lab, right?
Correct.
Yeah.
And we have that done all the time. This is probably the articulator of choice for the lab and most of the technicians here. One, it has the top member, you can hold it by it and it doesn't fall apart. Two, it has that calibration tool. So we have a lot of doctors that send us their articulators. We calibrate them so that they're matched up. And these stay calibrated across the board between all of them in the lab. So once you use one of these, it's calibrated. The cool thing about the calibration on these, if it's not calibrated, this plate here is flopping around. So it's either calibrated or it's not calibrated when it comes to that.
Now, if a doctor sent their articulator in to get calibrated, is that like a one-time deal, or?
Yes.
Okay.
Yes, good question. If he sends it in, it's a one-time deal unless something happens or you suspect that something's off somehow, and then you need to send it back in. But we have doctors that will send them in. We'll calibrate them and then use them for a number of years. And I think that's probably the case with yours.
Yeah, I haven't sent mine back in a number of years. Too many number of years, probably.
Stratos actually has good pricing. The other nice thing about the Stratos is those of you who are using the earless face bow, the Kois developed. We have, for a number of these systems now, they just came out with the Artex and the Cavo articulators, but the Panadent came out with it first, Stratos had it second, so we can actually transfer that with the jig that mounts on here and know that we're still going to be doing the same thing that you would have done if you spent the time to do a face bow. Those face bows, any of you, especially the younger doctors that are just out of dental school, you know there's 87 different things that you have to screw and dial all at the same time while the patient holds that jig in their mouth and holds those stylus in their ears so that you're getting something accurate. The thing that I like about the Kois face bow is it's still designed on the same averages between the condyles and the same relationship to where the front teeth are. The averages are the same, it puts it in the same position, but you don't have to go through all of that.
Right.
So if you
send a plate instead of all those screws
Correct.
that can be out of alignment, which is very common.
You send a $1 plate that's got bite material on it instead of sending a whole bite fork and then hoping that it doesn't fall apart somewhere between the doctor's office and the lab.
Right. And if you have a question on that, that's what we use in all our courses. It's a dental facial analyzer that John Kois developed. You could go to Panadent, PANADENT.com, and you could look at, because they're the ones that sell it. They sell an articulator, a great one, and you'll talk about that. But that dental facial analyzer could also be used, as we said, on 4 of these articulators now.
Yes. We still like that. This is the SAM. This is the most expensive system out there. We have a few doctors that use these, tend to be prosthodontists. There's some other cool things about the SAM. It's probably the best built of all the articulators out there. I mean, it's a tank. You can see it done really nicely. Nothing wrong with it other than you're sending the bite fork back and forth with this. I think their bite forks might be more expensive than
Yeah, they're
some
like
of these
$6.95 or
articulators.
something. So you can't use the dental facial analyzer, the Panadent. Yeah, and that's a real problem. That's why we don't use this in any of our courses for that reason. Okay.
Correct. Now, this articulator is the one we use in our occlusion course for good reason. If you understand where you're trying to go with the condyles and mapping out what's happening with the condyles on the patient versus the condyles on the articulator, and being able to go through the process of replicating what's in the mouth and putting it on an articulator the technician can use. The big advantages of these articulators is the way that Bob Lee, when he designed this, made these condyles on here. And this form right here with these condyles replicates the chewing pattern and the motions of the condyles in the mouth. The drawback with these is you have to keep these clean, and even then, this articulator is really tough to keep calibrated. We have to send these in on a rotation basis of once a year, and most of the labs I know that are using these, you have to send them in. It's a little bit expensive to send these through the process, get them recalibrated. A lot of times you have to unscrew these condyles and put new ones in here, and then sometimes you get them and they get to a point where you're done, you can't even fix those articulators. So that's something to keep in mind. But if you're going to use this articulator for what it's designed, and we don't have enough time in this little podcast here to go through that, come take the occlusion course with Dr. Montgomery and Dr. Hornbrook, and we actually have you be the patient, and we run you through what this articulator is really designed and built for, and it's able to do.
Yeah, on your own models.
On your own models,
Take
in
a
your
bite,
own
you
mouth.
mount your case, yes. Okay.
And in that course, you'll also learn how to use the Kois facial analyzer
Right.
and get your models mounted on here, and you'll understand the process of what needs to happen there. These other two articulators, great articulators, they stay calibrated also really well. But the Artex, you get this through Jensen. The Cavo is obviously through Cavo. Both fine articulators, nothing wrong with them. The magnetic systems, the mounting plates, they're fine. They can be a little on the expensive side. But now that we have the Kois system that can be used with this, it adds a little more versatility, and we tend to like them a little bit more. But honestly, the bulk of the cases that come through the laboratory for most of our doctors, this Stratos, I think out of all of these, is probably the least expensive. It does a great job. It has all the movements and motions of any of these other articulators, And
it has replaceable joint inserts as well. If you get to the point where you actually want to match or duplicate what your patient's angulation of the eminence, you can actually put inserts in there, which are nice. That's awesome. I think that helps a lot. And I'll tell you, having a relationship with other dental labs the last 20 years, I think the nice thing about the Stratus as well as the Panadent is you could probably call any lab and they have a Stratus and Panadent. And I know there's labs that they would say, well, you got to send your Artex with the case because we don't have one laying around. So anyway, I hope that helps clear some things up and answer some questions. JD is always here. You can go to jd@uvdl.com or you could give him a call at the laboratory. But I hope this clears some things up and helps you out.